Hi, I'm Dr. Aanchal Panth and today I'm going to tell you about Milia. What are Milia? What are its causes? How to treat it and how we can prevent it. So let's get started. So what are Milia? Milia are these firm papules that are seen on the face, usually around the eyes, but can occur on the cheeks and forehead or on any part of the body. So basically these are small keratinous cysts. These cysts are either attached to the epidermis, that is the upper layer of the skin, or the sweat duct, or the hair follicle, or sebaceous duct. So it can be attached to any of these four structures. So basically these are just a dermal keratin cyst filled with keratin. So what are the causes for Milia? It can be idiopathic, which is the most common. That means that there is no real cause for it. You just have a genetic predisposition to develop Milia. Second is genetic causes. There are certain genetic disorders that predispose a person to develop a lot of Milia. I don't want to get into the details of those genetic disorders. They are pretty rare, but that is also one of the causes. Then there are procedures. So if you're getting a dermabrasion done or even a laser done or anything that kind of injures the upper layer of the skin, that can lead to formation of Milia. And it can also occur as a result of applying occlusive agents on the face. So if you apply some thick creams on the face, that can lead to an obstruction of these ducts and occurrence of Milia. And even excessive sun exposure can lead to Milia. So if you're out in the sun a lot, not a few minutes in a day, but if your job requires you to be out in the sun for prolonged periods of time, that can also lead to the occurrence of Milia. So what is the difference between Milia and whiteheads? Whiteheads occur in the areas where there is increased oil secretion, so mainly seen on the face, on the back. It occurs due to obstruction of the pilosebaceous unit. So there's this hair follicle next to which there's a gland and there's an obstruction of the lining and plugging of this area with keratin. That is when you see whiteheads. And whiteheads are precursors for acne. Okay, so they are a type of an acne lesion which is dormant, which is non-inflammatory. That means there is no redness or any signs of inflammation associated with it, but it is a precursor lesion to acne. Whereas Milia is something very dormant. Even if you don't do anything to the Milia, it is not going to become inflamed or cause issues. It is just going to sit on your skin. Over time, Milia can become bigger, but can also just remain the same size. So how can we treat Milia? You would have noticed that sometimes Milia occur and then they spontaneously resolve. So if it is like that, then you can just let it be. Over time, they just reduce in size or just resolve. But if you're developing multiple Milia or the existing Milia are increasing in size, then you might want to treat it. The most common treatment that is done at a dermat's clinic is extirpation, in which we make a very small nick on the surface of the skin and just press the contents out. It's a 2-minute procedure and you will get rid of Milia immediately. I do not advise you to remove Milia at home, especially with a comedone extractor, because that is just going to push the Milia down and create a lot of inflammation that can lead to dark spots. Okay, so you don't want to do that. So best to visit a dermat and get these Milia removed if you feel it is bothering you. How can you treat Milia at home? There are no creams that can actually treat Milia. If you have a lot of Milia, you have to remove it, and then you can probably prevent the recurrence of Milia by using creams that contain retinol. So you can use a retinol based cream or tretinoin cream in a small quantity over the affected area. That can help in reducing the occurrence of Milia. Also, you can use certain glycolic acid based creams or an AHA BHA serum that can be used maybe once or twice in a week. That can help in reducing the appearance of Milia if you're somebody that gets a lot of Milia. So there you go, a short video on Milia. I was trying to avoid this video on Milia for a long time because there is nothing much that you can do. Either you wait for it to resolve or you visit a dermat's clinic and get it removed. There are no effective creams that can completely treat Milia. You have to go to a dermat's clinic and get them removed. If you want to reduce recurrence, then using a retinol based cream along with a glycolic acid or a sunscreen may help, but there's nothing to completely prevent the occurrence of Milia. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle, Dr. Aanchal MD. I make such content daily. Thank you for watching.